So prior to entering the patient's room, I did hand hygiene. Hi, my name's Ashley. I'm going to be the nurse practitioner taking care of you today. What's your name?
Kyle.
Nice to meet you, Kyle. So I heard that you're here for an annual physical. Is that correct?
Yes.
All right, so I'm going to be doing various assessments on you, going from your head to your feet. And if at any time you have any questions, feel free to stop me. So if you don't mind bending down just a little bit. So I'm just feeling his scalp. His head is normal cephalic. No presence of any lesions or any infestations noted throughout. I'm going to inspect your eyes. So there's no edema or swelling of the eyelids noted. Eyebrows are even, hair distribution, and follow to the end of the outer canthus of the eye. Big smile for me. So he has good facial symmetry, no droops. I'm going to go ahead and palpate your temporal artery here, okay? So you're just going to feel my hands here. His temporal artery is even on both sides at a 2+. His skin throughout, he has some maculas and some papulas on his skin. Hair distribution is even throughout. All right, I'm going to go ahead and look at your nail. So his capillary refill is less than 2 seconds. His nail beds are pink. And then if you could just put your 2 fingers together like this. So up high like that, and then 2 fingers together, just like that. And no clubbing noted. All right, I'm going to pull down your lower lids. His conjunctiva is pink, no exudate noted. His sclera is without icterus. Now I'm going to shine a bright light into your eyes, okay? So just focus on my nose. All right, pupils are perla at 3 millimeters. Now I'm going to shine a bright light onto the bridge of your nose. No strabismus noted. Okay, now I'm going to ask you to take this card. I want you to cover your right eye, and then I want you to focus on my nose with your left eye. Okay, and remove it. Okay, and then now we're going to do the other eye. Okay, go ahead and remove it. No strabismus noted and no lid lag. Okay, now I'm going to check the movements of your eyes. So now I'm testing for extraocular movements. So I want you to follow my finger with just your eyes. All right, wonderful. That was a normal test. No strabismus noted. All right, now I'm going to assess your ears. All right, normal configuration, position, and auricles of the ears noted, and they're symmetrical bilaterally. Okay, now I'm going to be testing your hearing. Okay, so the first test I'm going to be performing is the Weber test. Which ear do you hear the sound better in, or is it equal?
It's equal.
All right, so that's a normal Weber test. The next test I'm going to be doing is the Rhine test. If you can just turn your head a little bit this way.
It appears that when you moved the tuning fork, it got twice as loud in my left ear.
Now I'm going to test your right ear. Was it louder on the back here, or was it louder in front of your ear?
I'm having the same finding in my right ear as my left.
All right, so that's a normal Rhines test where air conduction is better than bone conduction. The last test I'm going to do is the whisper test, where I'm going to whisper 3 different items into your right ear, and then we'll do your left ear, and then I want you to repeat back to me what you hear.
Okay. One cat pizza.
Perfect. Now I'm going to test your other ear.
2-dog car.
Perfect. So the patient's nose is midline. He does have some small lesions on his nose. All right, now I'm going to go ahead and have you cover one side of your nose and breathe out. Good. Any trouble breathing?
No.
Good. And then cover the other. Any trouble breathing?
No.
Good. So both nares are open. Okay, now I'm just going to touch the tip of your nose and lift it up and inspect inside your nose. All right, so the patient's nostrils are clear of any exudate. His mucosa is pink inside with normal hair distribution. Okay, now I'm going to go ahead and touch your forehead and your cheekbones. Okay, so now I'm just feeling his frontal sinuses. Any pain when I push?
No.
Any pain when I push?
No.
All right, now I'm going to percuss. Any pain with that?
No.
Excellent. So I'm looking at his lips. They're free from any cracks, any fissures. They appear moist. So now I'm going to have you open your mouth. And I'm not seeing any dental appliances. Do you have any dental appliances in?
No.
Teeth are free from any cracks or chips that I can observe. All right, excellent. So now I'm going to have you open your mouth and say ah. The uvula rises midline. His tonsils are graded at a +1. His tonsils are pink. There's no signs of swelling. His uvula is pink. It's moist. No signs of exudate or swelling. His mucosa in his mouth appears to be pink and moist. Okay, so now I'm going to grab your tongue, okay? And I'm just going to inspect each side of your tongue. All right, excellent. So his buccal mucosa is, all right, so first I'm just inspecting his neck. His neck appears supple. His trachea is midline. All right, now I'm going to have you go through a couple movements and just test your range of motion of your neck, okay? So I'm going to have you put your chin to your chest, head up to the sky. All right, now you're going to look, and then look at the other side. Then I'm going to have you place your ear to your shoulder, other ear. All right, perfect. And now I'm going to put my hands on your face, and then I'm going to put some pressure on this side of your face. I want you to resist me, okay? Okay, now the other side. Okay, now I'm going to put my hands on your shoulders. I want you to shrug up. Shrug up. Okay, perfect. Excellent. All right, now I'm going to look at your thyroid. So I'm going to go from behind you. All right, go ahead and swallow for me. Okay, I'm going to displace your thyroid. I'm feeling for any nodules. None are present. Any tenderness there?
No.
Now I'm going to go to the other side. Feeling for any nodules. Any tenderness there?
No.
All right, excellent. Excellent. So his thyroid is normal in size and shape. Okay, now I'm going to feel for his carotid. His carotid is at a 2+. All right, and this carotid is at a 2+. They are equal bilaterally. All right, so His carotid arteries are normal. There's no signs of bruise bilaterally. All right, now I'm going to feel for your lymph nodes. Just let me know if you have any tenderness while I'm doing this. So all lymph nodes are normal that I've palpated, no signs of nodules. All right, so now I'm going to be assessing your jugular vein pressure. So I'm going to shine a light here just so I can find the internal jugular. And I can see it pulsating right there. Alright, so his jugular venous pressure is at 3 centimeters. I'm going to go ahead and expose your chest. Alright, so I'm just looking at his chest. I'm noticing that there's even hair distribution. There's some maculas and papulas present. He does not have any surgical scars. No lesions are present on his chest. Right now you're going to feel my hand. I'm just going to palpate your chest. Alright, so there's no presence of any pulsations, heaves, or thrills. So now I'm going to go ahead and listen to your chest. So I'm looking at the second intercostal space on both sides. Third intercostal. Fifth intercostal. Normal S1 and S2. No presence of any S3, S4, or murmurs noted. Okay, now I'm going to listen with the bell of my stethoscope. So once again, no bruits heard, no S1, S4, no murmurs noted. So now I'm going to go ahead and locate the point of maximal impulse, the PMI. So I'm going to go his fifth intercostal space. Mid-clavicular line. So now for the next part of the exam, I'm going to have you sit up and then swing your legs out. I'm going to listen to your heart sounds again. Patient has normal S1 and S2. There's no S3, S4, or murmurs present. No bruits noted. Alright, so now I'm going to listen to you again with the bell of my stethoscope. No murmurs noted. Okay, so now I'm going to have you go ahead and just lean forward. Oh, with your arms just at your side. S1 and S2. I'm going to listen with the bell. So a little more. There you go, perfect. Okay, now I'm going to listen with my bell. Alright, so throughout my exam, patient had a normal rhythm and rate on S1 and S2. And have you put your arms up in the air, arms down by your side, arms up and around, grab up here, put your arms here, arms to the back. I want you to hug yourself, put your hands here, hands palms up, place them back, hold the tray, put them back here, palms down, palms up, curl it forward, curl it out, go ahead and make a fist, open your fingers, I want you to put your arms out, and I want you to try to resist me pushing down. Good, good. And then go ahead and bend your arms like this. Okay, and then I want you to pull against me. Don't let me, oh, okay. And then push out. Good, good. All right, now I'm gonna assess your fingers. So I want you to close your hand. Try to open your fingers. Me resisting you. Very good. And then go ahead and I want you to bend your wrists that way. Resisting me. Very good. And then pushing down, and then so bend your wrist that way, and then try to push against me. Very good. So the patient has 5 out of 5 strength in his shoulders, in his elbows, in his wrists, and in his fingers. I'm gonna go ahead and feel for your epitrochlear and your axillary glands. All right, so I'm gonna grab your wrist. I just want you to relax your arm for me. Sorry if you're ticklish. All right, now I'm gonna palpate in your axilla. So I'm just palpating anteriorly. Sorry if you're ticklish. Superior. Posterior. And inferiorly. Alright. Alright, I'm just palpating for the epitrochlear. Alright, and then an axilla. I'm palpating the anterior, the superior, posterior, and inferior area. Just following it down his arm. Okay, so for the next part of the exam, I'm going to be assessing for carpal tunnel, doing the Tinel test. So I want you to let me know if you have any numbness or tingling in your fingers. All right, I'm going to set a tap here.
No. No.
Okay, excellent. So for the next test, we're going to do the Phelan's test, which I want you to put your, hands together up right here, and then I want you to put a little bit lower, right there. And I want you to hold it for 1 minute. I'm going to occlude. Okay, I want you to pump your hand 10 times. That was 5. 10 times. Alright, and I let go of the ulnar side. The blood return was less than 5 seconds, so that's a normal finding. I'm going to go ahead and do the other test, the other side. Go ahead and pump it 10 times. Alright, the refill is less than 5 seconds. Therefore, that's a normal finding. Radial and ulnar pulses and putting pressure. Alright, letting go of the ulnar side. Refill is within 5 seconds. Therefore, that's a normal finding. Now I'm going to test the radial side. Go ahead. I'm looking for any lesions, any deformities. I do notice some macula and papilla throughout. His hair distribution is equal and symmetrical. There's no obvious deformities. I'm going to go ahead and palpate his knees. Any tenderness there?
No.
No swelling. I'm looking at his ankles. Any tenderness there?
No.
And no edema present. Any tenderness on the top of your feet?
Nope.
Alright, and no edema as well. I'm assessing his capillary refill. It's less than 2 seconds bilaterally. Alright, so for the next part of the exam, I'm going to go ahead and have you follow me through a series of motions. So I can movements, so I can test your range of motion. Okay, so just follow me. All right. So first we're gonna lift our leg up, then the other leg up. Then we're gonna go and we're gonna open the legs, close your legs. I want you to kick your leg out, kick your other leg out. All right, perfect. Now I'm gonna have you put your leg back, and then push your other leg back. Then I want you to pump your feet up and down. There you go. And then I want you to curl your toes and extend your toes up and open them. Very good. And then I want you to move your ankles to the side and then ankles to the front. Very good. Excellent. Okay, so I'm going to have you try to open your legs against my hands. Very good. Very good. And then go ahead and close your legs in on my hands. Very good. Excellent. Okay, now I want you to kick your legs out.
Both?
Yep, both legs. Very good. And then pull your legs in. Very good. Okay, then I'm going to lift up your leg here. I just want you to push against my hand. Very good. And then pull. Very good. Go ahead and pull. Push. All right, excellent. So I'm assessing his nail beds. They're pink. No signs of cyanosis. Same here, nail beds are. So I just want to put some pressure here. I want you to kick up against me. Very good, very good. Same with the other. Very good, excellent. So his hip strength is 5 out of 5. Okay, now I'm just going to go ahead and feel for your different pulses. Okay, this one I'm just going to feel for right in your groin here, okay? This is feeling for his femoral pulse. All right, pulse is at a +2. And I'm feeling his other side. Pulse is at a 2+. Okay, now I'm going to assess for his popliteal pulse. All right, his popliteal pulse is at a 2+. Popliteal pulse is at a 2+. Now I'm just assessing his posterior tibial pulse. That's at a 2+. And on the other side is at a 2+. Now I'm assessing his dorsus pedis pulse. 2+. And on the other side. I'm looking for any varicose veins. Which I don't see any. Okay, so I want to see your range of motion. So I'm going to have you bend forward. So bend forward. No. Just bend forward. And then back up. And then I'm going to have you hyperextend your back. Very good. And then I'm going to have you bend to the side. So bend on this side. Very good. And then the other way. Very good. Excellent. So the patient has a normal range of motion. So now I'm going to place my hands on your hip and I want you to bend down nice and slow. So I'm looking for symmetry in his hips. And there is good symmetry. All right, I'm going to have you bend down one more time, nice and slow. So I'm assessing his spine, making sure that it's midline all the way down, which his spine is midline all the way down, no signs of scoliosis. All right, and then for the final part of the exam, I'm going to go ahead and have you walk on your toes. ahead and walk on your toes. Come and turn around and then walk on your heels. Excellent. Very good. And that concludes the physical assessment.